Hi and welcome to section 2 of session 23. In this section we'll talk about pharmaceuticals, but we'll also talk about some of the agents that were developed at the end of the 1900s and the modulation that they had on disease states. So in the 1950s we saw the advancement of antimicrobials, and this was called the antimicrobial era. And this was kicked off by the development of a product called nystatin, which is an antifungal agent, and it was isolated from soil in Virginia, which brought that product then to market. In 1950 as well, we saw a product come out of the Mayo clinics, and this product was cortisone, and that had a rapid impact on the treatment of arthritis. There was also in 1951 the development of MAO inhibitors, and those were antipsychotic agents which were introduced for the development of psychosis, or the treatment of psychosis. Anti-anxiety drugs, we'll talk more about in the coming slide. Those were introduced around the 1960s. And then we also had a product come to market in 1961, which was thalidomide. And you may know of thalidomide. It's the product that was used to treat morning sickness in pregnant women. That was used as early as 1957, but by 1961 they realised that this had a great impact on the development of birth defects. So babies were born from mothers who had used thalidomide with missing arms or missing limbs, missing fingers as well, for example, that was directly traced to the use of thalidomide. So that product obviously then was taken off market. So benzodiazepines are products that are used to treat anxiety, and these came in the 1960s and are still used to date for the treatment of anxiety. In 1964, we saw the Declaration of Helsinki, and this was really important because it brought to the forefront the conversation about the protection of human rights in clinical trials and human ethics in clinical trials. So in the 1970s, we also saw the development of histamine blockers and proton pump inhibitors for the use of peptic ulcers, or for the treatment of peptic ulcers. And then in the mid-1970s, we saw the statins come. And the statins were used primarily in the first instance for the treatment of familial hypercholesterolemia, which is high cholesterol with a family tendency. Because of the effectiveness of statins in treating familial hypercholesterolemia, the product was expanded for use in high cholesterol in the general population, and its use is continued to date, and it's been linked to a drastic reduction in cardiovascular events related to high cholesterol. Then in 1979, we saw the introduction to the market of transdermal patches. And transdermal patches are essentially adhesive patches that are placed onto the skin. Because they're adhesive, they stay on the skin, but they're lined with medication, and that medication is absorbed through the skin into the bloodstream. The period from 1944 to 1972 is known as the golden age of antibiotics, and in this time frame we saw an increase in life expectancy by 8 years related to the more widespread use of antibiotics. The widespread use, though, of antibiotics very quickly, actually within 4 years, led to the emergence of resistance or antibiotic resistant strains of bacteria. And that led to a new class of antibiotics being brought to market in 1999. And this class of antibiotics is called Zyvox. There are a number of factors that we'll talk about in the next slide which contribute to antibiotic resistance. And so we need to make sure that we're controlling antibiotic resistance within the population. Some of the factors that contribute to antibiotic resistance are taking antibiotics for the wrong reason. So taking an antibiotic, for example, for a virus. Antibiotics work on bacteria, and viruses are viruses, they're not bacteria. And so this increases antibiotic resistance. We also know that antibiotic resistance is increased because people will start an antibiotic for treatment, but they won't finish the course of antibiotics, and so that leads to resistance with that bacteria as well. But we also know that antibiotic resistance comes from the use of antibiotics in farming as well as in agriculture. So the slide that you're looking at now just points to some of the origins and evolution of antibiotic resistance. And there have been many contributing factors to antibiotic resistance since the 1950s. So this shows the dissemination of antibiotics and antibiotic resistance. And I guess a couple of the key things that I want to point out is the spread of bacteria from farm effluents and manure spreading. But we also know that antibiotic resistance comes from the use of antibiotic in food animals, as well as the use of antibiotics in hospitals and extended care facilities, as well as in rural and urban environments. And you'll see antibiotics in wastewater treatment plants, for example, which then goes into soils and into wildlife. And you'll also see the use of antibiotics in aquaculture, and of course then that impacts as well on other elements of the cycle. Okay, so childhood vaccinations. Despite a long-standing immunisation program, pertussis does remain still highly prevalent in Australia, and usually we'll see a resurgence of pertussis about every 3 to 4 years in Australia. The measles, mumps and rubella vaccination was actually pulled into one vaccination, which is called MMR. And then in 2010, we saw the introduction of the HPV vaccination to market. In 1982, Pneumovax was brought for the prevention of pneumococcal disease. We also saw in 1983 the introduction of hepatitis B vaccine. Okay. So let's have a talk about organ transplantation. The first transplantation that we saw was in 1954, and this was a transplantation of the kidney, successfully transplanted in 1954 in Boston. We saw the introduction of liver transplantation in 1963. However, the first successful liver transplant did not occur until 1967. Then in 1979, we also saw the first successful bone marrow transplantation, and this was in a child, and the child had primary immunodeficiency, and bone marrow transplant is used still to date for immunodeficiency, as well as other forms of cancers, such as leukemia and non-Hodgkin's. In 1968, we saw the first successful heart transplant, and that's the picture that you see here. That was Dr. Christian Bernard, and you see him in that picture conducting surgery. In 1987, we saw the first successful brain tissue transplantation, and there's hope now because of the success of that transplantation. It occurred actually in a woman who'd had a stroke and wasn't able to speak, but the results of that increases hope that brain tissue transplantation can also be used for the treatment of patients with Alzheimer's and neurodegenerative disorders as well. Okay. In 1962, we saw the first hip transplant, and then in 1969, we saw the beginnings of the first research into cochlear implants, and the research in that developed right up until the research in surgery prosthetics for that developed right up until 2010. But in 1978, we actually saw the first cochlear implant developed, and this was put in a gentleman by the name of Rod, and when this happened, he stood up and saluted and indicated, because he was able to hear music for the very first time. So that's really quite miraculous. In 2011, we saw the first artificial pancreas, which was quite significant, and that has quite a significant implication to patients with type 1 diabetes in particular. Okay, so let's move on to our discussion of imaging techniques. We've got a number of dates on the screen here, but the first one that I'll bring your attention to is the CT scan, which was 1972, and then MRI imaging in 1980. And MRI imaging is important because it helps us to see soft tissue. So, for example, if there's a damage or a growth, we'd be able to pick that up with MRI. Then also we see the development of positron emission tomography, so this is PET, and this is something that enables us to pick up metabolic processes. In 1953, John Gibbon realised his 20-year vision of performing the first open heart surgery with the development of the heart-lung machine. In 1957, we saw the development of cardiac pacemakers. First internal cardiac pacemaker was in 1958, so that was a cardiac implantation or pacemaker implantation. And by 2000, we saw biventricular pacemaking, so the electrode that you see in this picture here placed in both of the ventricles in the heart to facilitate ventricular pacemaking. 1978, we saw the development of the insulin pump, which was really quite a significant development for patients with diabetes. And then in 2007, we saw the robotic arm surgery, and in 2014 began the first research into the possibility of an artificial kidney. And so, as you could imagine, that has quite significant implications for patients with end-stage renal disease. Okay, we've seen a number of advancements in surgery related to the advancements in technology, and it can be quite daunting if you're in that environment and you don't quite know what's happening or what you're looking at. So the first coronary bypass surgery occurred in 1967. By the 1970s, we saw arthroscopy, which is the visualization of joints. And then in the 1980s, we saw the development of keyhole surgery, which is laparoscopic surgery. So as you can see, as time goes on, the surgical procedures become actually quite more refined. In 1988, we saw the first laser eye surgery. And then in 2011, we saw dorsal rhizotomy. And this was a technique or a surgery that was pioneered for neurosurgery, and it's been shown to have quite a significant impact on children that are born with cerebral palsy to help them to walk for the first time. Okay. So on April the 25th, 1953, two Cambridge University scientists described what's called what we now know to be the first DNA structure, or the first acknowledgement of what the DNA structure actually looked like. And this then led to the emergence of quite a bit of study in the area, looking into defective genes and how those defective genes impacted health and the development of diseases. The Human Genome Study was completed in the year 2000, and this was a mapping study that mapped some 30,000 genes and looked at the chemical sequencing of some 3 billion pairs of genes. So that's quite significant, and it's led to our understanding of genetic conditions and genetic predispositions, such as inherited colon cancer and familial breast cancer. So stem cell and tissue engineering. Stem cells are the cell from which all tissues in the body are made, or from which they become. Okay, so the first successful gene therapy or gene treatment occurred in the year 2007. We do have quite a number of research studies that have looked at the use of stem cells in spinal injury as a regenerative process. Okay, so let's move on to women and reproductive health. In 1958, we saw the development of the first Doppler monitor, which enabled practitioners to listen to the heartbeat of the fetus. And that really helped to pick up fetal defects or fetal heart defects, as well as to detect early stages to map the age of the fetus as well. In 1967, we saw the Abortion Act, which legalised abortion up to 28 weeks. That was reduced in 1990 to 24 weeks. And of course, as you can imagine, this opens up quite a bit of debate on both sides of people's belief system as to the appropriateness of the Abortion Act. And that debate obviously continues today. We also have seen an increase in women's health clinics that started around the 1970s, and this brought reproductive health to the forefront for women. It coincided with legislation that helped women with payments for childcare. But even though we've seen the advancement of women's health clinics, or clinics that are related just to reproductive health, that advancement hasn't expanded throughout the population more generally. And we do know that a lot of women in rural areas still don't have access to basic reproductive health services and preventative health services. And they also are at a great disadvantage because of the limited access that some of these women still have to healthcare resources and to healthcare information related to sexual health and reproductive health. And the very first cancer screening program came around in the 1980s, and this looked at cervical cancer screening, which looked at the cervix, which is the head of the womb. Okay, so for women's reproductive health, sexually transmitted diseases still continue to be a major public health issue in Australia, as do reproductive cancers. So there are a range of reproductive cancers, and these are cancers that are breast cancer or uterine cancer or ovarian cancer. For example, there are a number of early screening mechanisms that are used for early detection of reproductive cancer in women. We've also seen an improvement in fertility based on different diagnostic techniques secondary to the treatment of endometriosis primarily. Endometriosis affects about 1 in every 10 women, and it's associated with infertility at a rate of 30%. But with women's reproductive health, we also see delayed motherhood. By the year 2008, the mean age of motherhood had increased to 30.7 years. And so this has a number of health impacts for women. We've also seen family planning for women. And there are 6 organisations in Australia now that currently support a national approach to family planning for women and women's health services. So what are some of the predictions for the future? There are a number of health policies that are related to women's health. The first is to highlight the significance of gender as a key determinant or a key health indicator for a determinant of health for women, as well as for women's wellbeing. There's also the acknowledgement that women's health needs differ depending on where they find themselves in the life cycle. So the approach that you would take for the treatment or the approach for women's health for a young woman in her early 20s in her reproductive years is certainly going to be a different approach that you would take when a woman is pregnant versus when a woman is menopausal. So understanding what some of those impacts to women's and reproductive health are, and tailoring treatment and management and partnering with women at different stages in their lives will be very important for the management and the partnering of women's health and women's reproductive health for the future. There's also an importance that we prioritise the needs of women with the highest risk factors, and as well as how those risk factors intervene in poor health. Understanding that the health system needs to be responsible for all women as well will be important, as well as continued understanding of the factors that influence women's reproductive health and women's health overall. Okay, so contraception is one of the major factors that we've already talked about that has impacted not only population health and population growth, but also women's health. In the 1950s, we saw the first introduction of IUDs, so those are intrauterine devices, the device that's put inside the uterus for the prevention of pregnancy. And in 1961, we saw the contraceptive pill be made available for married women only, and this extended to all women by 1967. In 1983, we saw bar implants. So these were initially 6 rods, and then they decreased to 2 rods, and then went down to single rod implantation by 1998. And in 1992, we saw the introduction of Depo-Provera. And then by 2000, we saw the introduction of the contraceptive patch, which is that transdermal patch. Okay. So let's have a talk about assisted reproductive technology, because this certainly has had quite an impact on not only women's health, but also on conventional medicine. In 1978, we saw the first test tube baby born, but actually in 1973, we actually saw the first IVF pregnancy occur in the world in Melbourne, Australia. That pregnancy lasted 9 days. And the first test tube baby was actually born in July of, or IVF baby was actually born in July of 1978. We did not see our first IVF baby born in Australia until 1980, however. Okay. In the 1980s, we also saw the gamete intrafallopian transfer. So this is where the washed sperm and the washed egg are put inside the fallopian tube for implantation. Then we saw ICSI injections in 1992, and intrauterine insemination began to develop after that, as well as the introduction of fertility drugs, which introduce certain hormones to the body to enhance reproduction. Okay, so some food for thought. List the major areas of technological or scientific development in medicine since the 1950s and some examples of each of those. How have various contraceptive methods changed the lives of women worldwide? Reflect on how modern technologies or modern scientific developments were made possible by historical philosophers, scientists and doctors. And some other food for thought. Can tissue engineering mark the dawn of a new golden age for medical advancements? And could disease organs simply be replaced with engineered organs, for example, for patients with the use of their own stem cells? And how much could this increase our lifespan, or how might it impact global population?